Our host today is Mr. Ken Roberts, our president. Mr. Roberts, take it away.
Thank you, Debbie, and thank you all for tuning in today. And as Debbie mentioned, we're going to be doing this on a weekly basis and more often if there is a big demand for it. I want to talk a little bit about the surge and let everybody know that, yes, we are seeing an uptick in the number of COVID positive patients, not just here at Mather, but across the whole United States and certainly across Northwell. However, I want to make sure that everybody understands that this is something that we had projected and planned that would happen. So we have a lot of, we planned around it and we are ready for it. It's not something that surprises us at all. We have enough PPE to go around, and the Northwell system, as well as all the management and leaders at Mather Hospital are ready for this. So it will be a long winter. We are up to 35 COVID positive patients in the hospital now. We have 5 in the ICU. We have 1 on a ventilator. What we're seeing across the system is that the patients are not as sick as they were in the spring, and we're trying to keep them off ventilators and just use the high flow and oxygen and not to put them on ventilators as for treatment. So we're not seeing them, we're not seeing as many patients, and we're not seeing as sick patients as we saw in the spring. We are expecting more to come in because we think that a lot of the rules that the governor put out about celebrating Thanksgiving at home with just the people in your house were not followed. And so that over the next 5 or 10 days, we expect a much bigger admission to the COVID positive patients as that Thanksgiving rolls over the system. I'm going to come back later and answer some of the questions that you put up on the screen, as well as answer some questions that I think that were not answered last time. We did get some information. At this point in time, I'd like to turn it over to Olga Larios. Olga, take it away.
Thank you, Mr. Roberts. Good afternoon, everybody. Just a quick update from the last time we spoke. I appreciate the ability to do this. We have frequent meetings with our Northwell Pharmacy Service line. Very grateful for that. As of last evening, just out of interest, 622 patients are in the entire Northwell system, with Staten Island having 154 of those patients. So obviously the hub is farther west. As Mr. Roberts just mentioned, our patients are younger and fewer patients are on vents, which is certainly a blessing. Last time somebody had asked about the recommendations from the CDC. If you have antibodies or you at any level, you are still, it is still important to look into the vaccine. And if you've already had the disease itself, it's also very important to take the vaccine since it is possible to contract the disease more than once. Very quick summary on the monoclonal antibody situation, which we're definitely up on here. We see it on the news frequently. As we know, Eli Lilly has released their single monoclonal and Regeneron has their double cocktail, as we call it. Most hospitals are receiving, myself included here at Mather, are receiving doses of these vaccines. However, Mather is not a hub for the vaccine. People have been asking that. There are only 3 hubs right now, and they are Staten Island, Southside, which is now South Shore University Hospital, and Northern Westchester. In the next couple of weeks, we are hoping to open Lenox Hill and Manhasset as well. So when I get the vaccine, when I get the antibodies in, I must ship them out immediately to central location at Northwell, which we did just a few minutes ago. So we're going through our remdesivir. People ask about that extremely quickly. Our numbers are rising. We're staying on top of it. We have received 2 supplemental orders since our original order, but we do have enough for all of our patients, and we get them to the individuals and our patients as quickly as possible. We're working very closely with nursing, as we should, and along with our ID colleagues to make this as fluid as possible, and we do require cooperation, which we are getting. We had a couple of issues with patients who at the very last second have decided to not go with remdesivir, but that's far and few in between and totally understandable given the situation here. Everything going very well, as I said, as far as remdesivir goes. So I'm going to switch over to the vaccine right away. And so we're going to talk about that. There's a lot of update, tremendous amount of work on the part of the pharmacy service line at Northwell, constant meetings, all kinds of different lessons and 10 or 12 screens, the ordering process. As I mentioned in our last meeting last week, These are frozen vaccines. So I just wanted to give some background. It was interesting for me when I was researching for today, what's the common source of where we're making these vaccines? And it's really the adenovirus from a chimpanzee, which I didn't know until yesterday afternoon. We're getting the genetic material from that, and to check and see, because it seems to be the common for the COVID spike and helps to prime our immune system. So there's a fact right there. Again, the side effect is going to be common according to what we know, and it will be probably a sore arm in addition to possibly a slight to moderate fever for the first day or two. Most of these vaccines, the ones that Mather is going to be receiving, will be 2 doses. And that will be the Pfizer vaccine, 2 doses, 0.3 mLs with 30 microgram dose, 21 days apart. I had a discussion this morning with Dr. Marie Mulligan, our CNO, and we're all going to put our efforts together to put a team together so that we can make this as easy as possible and as effective and as efficient as possible for our employees. We have to stay on top of it as far as who needs to come back in 21 days. The DOH at this point is saying that it really is incumbent upon the hospital to come up with a system whereby people can be reminded that they are due for their second dose. So that's going to be important. Dr. Mulligan has said she is going to have several people in on this committee, which is going to be excellent. And we're assuming that things are going to go well. The Moderna vaccine is a little bit different. It's 28 days apart with 100 microgram dosing. And that will not really be available until very early in the first quarter of 2021. AstraZeneca has jumped back into the loop. People have asked me, are we going to go with that? That's an interesting concept. Not right now. They have not been approved, and they're still in their phase 3 and 4 trials. And the difference there is that they're coming up with half dosing, and they're doing half dosing for the first dose and full dosing for the second, claiming that they can possibly produce a 91% efficacy rate, whereas right now the Pfizer efficacy rate will be 95%, followed closely behind Moderna, which will be 94.1%. Moving on, J&J is also back into the limelight here, and they are going to go well into the first quarter of 2021, and they are trying to come up with a single dose vaccine. So this is just news that we're having. It does not affect what we have here. Again, Mather Hospital will be receiving the Pfizer vaccine. I finished the registration process. I have competencies I have to complete, et cetera, in order to be able to have the vaccine come into the hospital, and I will take care of that. I did get a few questions as I walk the hallway sometimes on what the phases are, who is going to go first as far as our employees. I did do some research on that, and we talked about this yesterday, and it's going to be the healthcare workers, particularly in the ICU, in the ED, and our EMS workers, which is obviously common sense at this point. In addition, the state has said that long-term care facility, especially those workers in our nursing homes and rehabs who deal directly with patients. And I think that's pretty much what I wanted to cover today. I know I'm limited in time because I have my colleagues who are also going to go. I'm expecting vaccine as early as December 12th, 13th, 14th, sometime around there. It really all depends on when the FDA will make their final approval. 2 days later, we should be receiving the vaccine as a system. And I'd be happy to, take questions if you like. And thank you, Mr. Roberts, for the opportunity.
Thank you, Olga. Again, if you have questions, you can hit the little Q&A button and type your question in, and we'll be answering them at the end. At this point in time, I'd like to turn it over to Dennis Kramer.
Hi, good afternoon, everyone. We put a security initiative in on Tuesday, November 24th, when the hospital decided to suspend all visitation with the exception of end of life and for pediatric patients. There was concern amongst staff about with the uptick in the community, having many visitors coming in. So a determination was made to end visitation. There's been also questions regarding whether or not we're going to limit employee entrance into the hospital. Right now, there has been some discussion, but we are still going to use all of our employee entrances. My feeling is that at some point in the future, if the uptick continues in the community, we will probably look to close down some of the entrances and make sure that everybody is coming into a team entrance. Other than that, from a security perspective and standpoint, I have nothing else to report.
Okay, thank you, Dennis. I'm going to turn it over to Joanne Lawton at this point in time.
Good morning, good afternoon, Mr. Roberts, and thank you for asking me to speak. So from an infection prevention standpoint, we're really trying to keep on top of things. There are several points that I do want to make. I'm very, very concerned about staff spending time in their break rooms. We have decided to work on opening up 2 more conference rooms adjacent to the cafeteria, so we'll have a little bit more room for staff to come downstairs and get off the unit. They need to get off the units for their own well-being and their own mindset for the day. So we're strongly suggesting that they take their breaks off the unit in a conference room 3, 4, and 5, which would be a part of the cafeteria. Remember that the importance of social distancing also in the cafeteria. Decals have been put down for that. So I'm going to make sure that I do round in the cafeteria on a daily basis to make sure that there is social distancing. The other reminder is that if you are done eating and you are not, and you are finished eating, you are to put your mask up. You are in the break room in between. You need to have your mask up. It's very, very important. Some of the other questions that I've received are, how often do I change my N95? You need to change your N95 if it is dirty, if it is soiled, if it is wet. You need to go to your nurse manager or your direct report, show them what your N95 looks like and request a new N95. We will be careful on how we give these out. So I'm going to ask you to please try to refrain from wearing makeup. I've stopped wearing it. The makeup soils your N95 and it makes it harder for you to keep them in a longer period of time. As we get into a longer stretch, and this is going to be a long winter, I kid you not, it will be a very long winter. So be prepared. We have to think about us as bears and hunker down, and we will get through this. If you get an opportunity to look at the Newsday every day, or to look at the New York State Department of Health webpage, you will see what your community looks like. So for example, I live in Selden. Right now, my positivity rate in Selden is 10. If you live in Coram, your positivity rate is 15%. So that is per 1,000 residents. So if you see the uptick in your community, these are the areas where we live, which means that we're going to start to see more of an uptick in our hospital, which is also why we see more of an uptick in our employees becoming infected. So I urge you to be vigilant. If you do not have to go out, please do not go out. They've made some recommendations of if you're over 65, they're requesting that you do not go out. So although they're not putting a stay-at-home order in place, they're requesting that. I am available for any questions. Please reach out to me or my staff in the infection prevention department, and we will be more than happy to answer any of your questions. Thank you, Mr. Roberts.
Thank you, Joanne. At this point in time, I would like to mention that we have posted for a couple of weeks now, I believe, the census of the COVID positive patients in the hospital. And I'd like to have the screen shared to show on the internet exactly where you can find that. So if you go to the internet and you hit the COVID-19 inpatient census, you'll see this graph that comes up, which is a 2-week rolling graph that shows you how many patients are in the hospital as of yesterday. And please note that on December 1st, the scale on the chart was adjusted from 0 to 30 because we were only seeing 2 patients or 3 patients. And then when we popped up, it wasn't appropriate. So we changed the scale to 0 to 80 patients, but you still get the 2-week timeline. So you can see that we are ticking up, and this is pretty much what all the other hospitals that I know of, which are the other Northwell hospitals in the Eastern region, are also seeing. Very similar right across the board. I'd like to just go into some of the questions that were asked last time that we didn't answer, or probably have some more additional information on. One of the questions is, will the employees with antibodies, will they get the vaccine? The answer is yes. You will not be tested for antibodies. And if you, whether or not you've had COVID in the past, or you have antibodies, or you don't have antibodies, you are eligible for the vaccine. Secondly, can computers on wheels be taken out to be fixed? The computers are really cleaned by the cleaned on the nursing unit prior to be taken out. So yes, they can be taken out, but the IT people don't have to, my understanding is, go to the floor to fix the computers. Will pregnant women be able to get the vaccine? The answer to that is no. My understanding is that during the testing phase, children and pregnant women were not tested, so it's not advisable for pregnant women or children to get it. I believe Pfizer just started testing children in October, so the answer to that, to children getting the vaccine, might change at some time in the future, but at this point in time, children and pregnant women are not advised to receive the vaccine. The last question is, what is the hospital policy on the new vaccine as it relates to employees? And one of the questions that we had today is, will this vaccine be mandatory for all employees? So I think that that's the question that's being asked, or was asked last time. These vaccines are being made available by way of an emergency use authorization, or EUA. And they are not allowed to be mandatory at all because of the emergency use authorization. They are not approved by the CDC. That will happen at some time later. So there is no ability for us to make them mandatory for all employees. And Northwell has stated that they have no intention at this point in time to make it mandatory for the employees. However, there is a possibility that the state, some state government or the federal government can make it mandatory at some time in the future. But that's the answer that we have at this point in time. Another question is, what happens if for some reason a person can't get the second vaccine as scheduled? For instance, they're being sick. So you get the first vaccine, vaccination, then 3 weeks later, you get the second vaccination, and then a week after that, you become your immunity, you get immunity. If you do not get the second shot, or the second vaccine, the booster, whatever you want to call it, you do not get immunity. And that's what happens. Whether or not you can get it if you're sick for that week, and then you, Olga, can you answer what happens if they're sick for a week and then they come back 4 weeks later as opposed to 3 weeks later and they look to get the booster?
I can't say with any certainty, Mr. Roberts, but I know that, these are very strict time elements at 28 days, 21 days. I can find out if there's any leniency with a few days or so, and I will get back to you and get back to the employee who's asking the question. I don't know the answer to that offhand.
Thank you. There are some reports that the people getting the vaccine had an issue with with either fever or fatigue or their arm hurt, and they did not come back for the second shot, and those people do not receive immunity. So that's the whole point of getting the vaccine. Another question is, in general, let's see, let me just get this. In general, picking up prescriptions over in the Medical Arts Building, do we have to fill out the COVID questions prior to pickup? So my answer is, if you're an employee and you're coming into the hospital, yes, even if you're not working that day, we would expect you to fill out the COVID questionnaire prior to coming into the hospital, prior to coming in. Next question is, the literature has stated the Pfizer vaccine should be given 28 days apart and the Moderna 24 days apart. Is this only an approximation? I thought you indicated the Pfizer will be given 20 days, 21 days apart. How difficult will it be to provide recipients with the same lot number of material? I was also under the impression that the two vaccines on the FAST list were made from synthetic RNA, and only the AstraZeneca was taken from adenovirus from chimps. My understanding is that the first two, the Moderna and the Pfizer, are messenger RNA, and that you're correct that the AstraZeneca was taken from the adenovirus from chimps. So, but I'll turn it over to Olga.
Well, from the information that I have there, it's 21 days for Pfizer, 28 days for Moderna, And the way that I have the information in front of me, but I will double check it as far as is the messenger RNA. So it's maybe the way that this information sheet is written, but I'll go back and corroborate it and make sure that's correct as far as the chimpanzee adenovirus is concerned.
All right, thank you, Olga.
You're welcome.
Next question is, where can I find out the data about positivity rates that Joanne reported by town? Okay, I think that we will have to get you that information later on.
I can give you that information, Mr. Roberts.
Go ahead.
So it's actually on a page in Newsday every single day, and it's also located on the New York State Department of Health COVID page. And I will send directions out to that tomorrow.
Okay,
I'll send
great.
it out through management staff if that's okay.
Yes, that's fine. And I think that the COVID page, the New York State COVID, can be found on the intranet. I believe that's correct. Because
Yes.
they have under travel, if you hit the button about travel restrictions, and you want to learn about the states that you can't travel to, which is pretty much any state that doesn't, touch New York State. Next question is, are there restrictions to be placed on the outpatients who present to the hospital? For example, if a patient has an appointment but brings someone with them, will they be told that they cannot enter by security as we were doing during the first wave of COVID? Dennis?
That would be correct. They're going to be asked to either wait outside in their car or come back at a later time to pick up the patient.
Okay, thank you. Next question is, if we need a COVID test, will our own employee health test us? Actually, if you need a COVID test, if you're exposed on the outside, you go to sign on to the Northwell questionnaire in the morning and you answer yes to one or several of those questions, and you are told by employee health that you can't come into the hospital and that you have to have a COVID test. You're not to come into the hospital to get a COVID test. You're actually being sent to one of 4 or 5 or 6 urgent care centers in the area to get the COVID test. They're also in the process of setting up a special testing site for Northwell employees. Mather employees are included in that, by the way. And the nearest one, I believe, is in Riverhead. And Kevin, where's the second one? There's another one, I think, in Comac. Yes, Kevin saying yes. So there are, and that's not set up yet, I understand. And to get tested there, you actually have to make an appointment. So you'll have to go onto a Northwell site and put in information to get a scheduled appointment. And we will be giving you information on that later on. Kevin, do you want to speak to that?
I just wanted to add, Ken, it's also for family members of employees as well, not just for the employees themselves, but if you have kids who have come home from college or have traveled, we're just setting up these employee and family only testing sites, and you will be able to make an appointment, unlike the urgent care centers where it's first come, first serve, and there are no scheduled appointments. So there'll be more details coming out on that, I imagine, over the next couple of days.
Thank you, Kevin. And when we say family members, they have to be family members that reside with you or are your dependents as per the your IRS form. So it's not your brother or your sister-in-law or your great uncle or whatever. It's people that are dependent upon you. Next question is, there was an email from Mark Salazzo that came out today regarding these testing sites. Okay, so I haven't even gotten to my emails today, but I will. Thank you, Denise. All right, I do not have any other questions at this point in time. I want to say that there will be a survey that will be sent out. We'd like to get your feedback about these check-ins. We'd like to hear your questions that you would like to, the topics that you'd like to hear at the next check-in, whether or not you agree that the timing of these once a week is appropriate. Are there other speakers that are here at Mather Hospital that you'd like to hear from on other topics? At this point in time, I want to thank all of our speakers today. Debbie Garsick, thank you for the introduction. Olga Larios, Dennis Kramer, and Joanne Lawton. Other questions, I will say that goodbye, and we will close out this meeting, and we'll see you next week. Thank you for signing in.